Welcome back. This is Dr. Jin Sung, and this is part 2 of anxiety depression. Before I get started, please subscribe to the page and like the page and share it with others because there are a lot of people who have anxiety and depression. So I'm going to go ahead and recap some of the little nuances that we talked about last week, and then we're going to go into what can we do about it? What can we do to help people with this chronic anxiety and depressive moods? Okay? So if you remember last week, we talked about the different symptoms. So I'm going to go ahead and name them off, right? We have an anxious mood, we have inner tension, fears or unwarranted fears, insomnia, intellectual deficits in terms of cognitive function and so forth, depressive moods, no motivation whatsoever. We have some somatic things in terms of like grinding your teeth, muscle pain, etc. And then sensory changes, blurred visions, you have abnormal sensations in your hands and feet, feeling of weakness when you're actually not. Cardiovascular signs is one of those things where you have increase in heart rate, you feel like you're missing a beat almost, like your heart is thumping but it's not, or you feel like you're skipping a beat. Okay? Your respiration will change, or the number of respirations will change per minute. You'll have GI issues, whether it's diarrhea, constipation, also urinary issues in terms of frequency. So you'll go to the bathroom, turn around, you get anxious and nervous, or go to the bathroom again and again. And it's not a urinary tract infection, but a issue with your autonomics. Okay? Behavioral changes is one of those things where you have restlessness and anxiety. And you also have autonomic issues, right? Increased sweating, maybe on one side versus the other. So these are all signs and symptoms that you may have anxiety or depression. Another one is looking at balance problems. So people who have balance issues or long-term issues with coordination and lack of sensation in their lower extremities, they can develop anxiety because every time they stand, all of a sudden, they feel like they may fall, or even though they're stable, they have that memory of like they're gonna fall. So the anxiety goes up. So people who have balance problems will also have issues with anxiety. Okay? So let's go into some of these mechanisms. So we talked about thyroid. Thyroid, when you have Hashimoto's thyroiditis, which is an autoimmune condition, your TSH, or thyroid stimulating hormone, will go up and down. You'll have this fluctuation of your thyroid hormone, and when your TSH goes up, you become hypothyroid and you feel very sluggish, you want to sleep, your hair is falling out. And then you can get a little bit of a hyper state during Hashimoto's where you feel anxious and your heart is racing and so forth, right? So testing properly for Hashimoto's thyroiditis is very important. You need to run something called TPO and TGB antibodies that your medical doctor can do very easily. So if you are on a thyroid medication, you need to know if you have the autoimmune version of it, which is Hashimoto's thyroiditis. About 80% of all under-functioning thyroid here in the United States is Hashimoto's thyroiditis. It's an immune dysregulation or an autoimmune issue. So you need to know whether you have that condition or not, right? So modulating Hashimoto's thyroiditis is very important. Things that will help with Hashimoto's thyroiditis is elimination of gluten and dairy, improving vitamin D levels, improving glutathione levels, and improving essential fats in your diet, okay? Allergies or environmental exposures, right? If you are allergic to your dog, right, then you have to consider, do you really want to take Benadryl all the time so you can have the dog? You know, it's a hard decision and question whether you want to give up a loved pet. But if you have an allergic reaction every time, and every day your nose is running and you're sneezing and so forth, you are creating an inflammatory response. You are creating an immune response. Therefore, it can throw your autonomics off, right? Your balance between sympathetic and parasympathetics. So it's very important to eliminate environmental triggers or environmental static. Okay. The other thing is diet. Diet is really the crucial portion of all this, right? I just had this patient, right? She came in, she has anxiety, depression, sees a counselor. Okay, she's on 2 meds, and she was still anxious, depressed, and could not get better. So what did we do? We implemented a dietary and nutritional protocol, and her anxiety and depression, as of today, when she came in, was almost 0, right? Because we removed inflammatory triggers for her, and her anxiety went away. So, in terms of diet, you need to be gluten-free, dairy-free, soy-free, lectin-free, and nightshade-free. And you need to do it for at least 8 weeks to see if it makes a difference for you. Don't do it for a week and say, oh, it didn't work. Do it for at least 8 weeks so you know whether a dietary program like that will work or not. So a good place to look is a place called The Paleo Mom, right, or Nom Nom Paleo. We'll do a subtitle on the video so you can actually see which websites we're talking about. And look up AIP diet, or autoimmune protocol diet. And I'd like you to follow that dietary menu for 8 weeks. Unless you have a specific medical condition, you can follow it for 8 weeks pretty safely. Otherwise, go and meet with your doctor and make sure it's okay for you, okay? The other thing is hormones. Hormone fluctuations, PCOS, or polycystic ovarian syndrome, irregular menstruation, moodiness around menstruation, going from pubescence into menstruation, or menstruation into menopause, you may develop anxiety. So it's important to make sure your hormones are also regulated. Okay? There is a simple test that you can do either through saliva or through blood and figure out, do we have hormonal deficiencies? So it's very important to regulate hormones in patients who have anxiety. The other thing is, do we have infection? Do we have any Lyme infection, right? If your anxiety comes on very suddenly, right, think about exposure, right? You're perfectly fine, and all day, on one day, you wake up and you feel like your heart is racing, you feel anxious, I don't know what's going on with me, right? I'm sleeping a lot more, I'm not wanting to meet with my friends. You have to look at an acute exposure. And what we look at is things like Lyme disease. We look at microtoxins, mold and fungal exposures from water-damaged homes. And the other one that people really neglect is strep infection. Strep infection, the ones that you get in your throat, can migrate at times to parts of the brain and create anxiety and depression, even OCD or obsessive compulsive disorders, right? You can also feel like you're going crazy. So strep infections in the brain called PANS or PANDAS are the ones that we're looking for when you have an acute onset. It just kind of comes on and you don't know why it came on. Look for environmental exposures, Lyme, microtoxins, and strep infections. You need to figure those things out in order to get to the root cause of anxiety. It's so important to get to the bottom of it, right? Next thing is something called pyroluria, which is really a B6 and a zinc issue. Those are easy to do. You can even just try some B supplements along with zinc to see if it helps with anxiety and depression. You can go online, and there's actually companies that formulate this stuff with the right amount of B6 and zinc, and that might be beneficial for people who have anxiety and depression, all right? The other one is magnesium. A lot of people need magnesium, and there's deficiencies there. So one way we can even figure out if we have deficiency is, does your muscle cramp, right? Do you have paresthesias, right? You can't sleep very well. Are we constipated? Look at those things. You may be deficient in magnesium. Another one is heavy metals. There's a lot of exposure to heavy metals. One from living near airports, water contamination, arsenic from food, herbicides, pesticides also, amalgams, fillings in your mouth. If you have a lot of fillings in your mouth, you may be exposed to amalgams or mercury fillings, especially if you have those silver ones, right? If you have those silver ones and you've had them forever and you never feel good, I don't know why I don't feel good, you may have some issues with mercury. So heavy metal toxicity is another reason why you may have anxiety and depression. The other thing is balance problems. If you have balance problems, you need to figure out where it's coming from. Is it peripheral, right? Or is it central? You need to determine that, right? You might have something called BPPV, which is very benign. You can take care of someone who has that very quickly, right? It's positional. So there are maneuvers that you can do to help correct that in maybe 3 to 4 visits. But some people have maybe had a concussion or had some chemical trauma, or they had something that went on that affected the central vestibular system, right? Your cerebellum. So if your cerebellum is affected and you feel dizzy or feel car sick every time, you feel nauseous, then you may have a central vestibular disorder. Sometimes your vision will be off. So in order to determine that, we need to do what we call a functional neurology exam. We look at eye movements, balance, coordination. Do we have tremors? Do we need to figure those things out in order to determine if balance is causing anxiety for you? And oftentimes people who have anxiety will also be fatigued because they're always ramped up, right? They're always ramped up and then they're tired, but they're wired and they can't fall back to sleep and so forth. And going back to your basic fundamentals, if you can't calm down, then you can't sleep, then you can't poop, right? You can't eat very well. So you got to look at those types of things. Another thing is blood sugar. Blood sugar plays a big part for anxiety and depression, especially hypoglycemics, people who have low blood sugar, right? If you have low blood sugar, what will happen? Let's say you eat and you feel better from anxiety, or if you skip a meal and you go from, let's say, breakfast, you skip breakfast, you go into a late lunch, and before you eat, you're getting shaky, getting nervous, you feel like you're going to faint, right? As soon as you eat, you go, oh, I feel so much better, right? Those are people who are hypoglycemic. You have blood sugar problems that's causing anxiety. So you have to regulate blood sugar, along with anemia or blood flow. You need to rule out, do we have iron deficiency anemia? Because iron is utilized in your neurotransmitter formation. You need to have proper neurotransmitters for your brain to fire and function. So you need to figure those things out. Are we anemic? Do we have blood sugar problems? You have to take care of those things, right? The other thing is post-traumatic stress, post-traumatic trauma patients, childhood traumas, sexual abuse, and so forth. Those types of things, you really need a counselor along with what we do. You need a professional who is well-versed in the psychiatric world or psychology world of handling patients or symptoms like that with patients, along with what we do, because we can get better outcome for those patients. So it's very important to have a medical professional when you have significant emotional trauma or physical trauma, okay? So when we look at patients, what do? We look at all of these things. We need the proper testing. You need to figure out what's going on and then address those underlying issues. Otherwise, you'll never get better. You'll always be on a medication, right? If not, they'll double up on the medication. It's so important to get to the underlying causes because it will affect your life moving forward, right? The rest of your life. Do we want to be on 1, 2, 3, 4, 5 different medications for this? Or do we want to take control of your life, right? Do we want to take control of how you feel? Oftentimes patients don't understand why they feel the way they feel. right? And I'm telling you what the underlying mechanisms are. We need to figure those things out for you, so therefore you can get to the underlying cause. Right? In our office, we use something called functional medicine, which is looking at your dietary lifestyle along with nutrients. Are we getting the proper nutrients to handle these conditions? Right? Do we have parasites and bugs and microtoxins and Lyme? Do we need to figure those things out, right, with a thorough consultation, and then address those issues, or else you'll never get better. Right? If we have balance problems, we need to do balance rehab. Right? We need to rehab the vestibular system or the central vestibular system for you to feel better. Right? If you have autonomic issues like POTS, right? Postural orthostatic tachycardiac syndrome, where you have issues when you stand up, your heart rate goes up. So those are autonomic issues. So if you have all these things going on, it's very difficult for you to feel better. You need to correct the underlying cause. One of the therapies I like to use in my office is something called Neurofeedback. We use a company called Neurooptimal. It's a great way to help balance the brain, right? It's passive, one. The patient is on these sensors that we put on your ears and your head, and it feeds back to a very sophisticated computer program. Will help to modulate some of your brain waves, and modulating the brain waves will help calm the autonomic system. So it works very, very well for anxiety, depression patients. Even ADD, ADHD, OCD, it helps significantly with those types of patients. So neurofeedback is one of those therapies that we find invaluable in taking care of patients who have anxiety and depression. So listen to this lecture very carefully, because we threw out a lot of stuff here. And you can do some things, your basic stuff, right, on your own without even coming to our office. Right? Change your diet. Gluten-free, soy-free, dairy-free. To give you those websites where it's The Paleo Mom and Nom Nom Paleo. Look at AIP diet, or autoimmune protocol diet, right? And then you need to exercise. You need to sleep when you're supposed to be sleeping. And the last thing I failed to mention was electromagnetic frequency exposures, or EMFs, right? You need to get off of your phone. You need to get off of the Wi-Fi. You need to get off your computer. Get off your gaming console. You have to get away from all these electronic products, right? Because that drives certain parts of the brain which will make you more anxious, right? What is the purpose of checking your email 10 times in an hour? What is the purpose of looking at Snapchat or Instagram or whatever you do, right? Every hour, on the hour, 3 or 4 or 5 times a day. Or 3 or 4 or 5 times every 10 minutes. What is the purpose of that, right? You just get this little pleasure of someone responding to you. That's it. It's very temporary. You're driving the dopamine system, you get a little reward, and you feel a little better, and then you got to do it again. And it creates problems. Get off the electronic products. Stay away from the EMFs. Stay away from your cell phones. Turn it off at night. Don't put it under your pillow, right? Another thing you can do in your house is look for Wi-Fi that you can shut down every night. You don't need to have it on when you're sleeping, right? Shut it down. Look at your smart meters, the meters that give signals out so they can read your meter. You might want to look at using a cover over that to block some of the radiation that comes off of it, or the waves that come off of these smart meters. It's very important to do some of these things in the long term, because we are bombarded with frequencies, right? Think about it. You have satellite radio, you have EMFs from cell phone towers, you have radio frequencies, you have HD TV frequencies, you have satellite TVs, you have phones, right? You have Bluetooth. You have all these frequencies affecting your body, right? You need to take a vacation from it in order to feel better. Okay, that's my rant on EMFs. You really need to look carefully at how much EMF exposure you have, along with everything else that we just mentioned. Okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. All right? Have an awesome week.